Welcome, and thank you for choosing AliMed as your partner in patient safety. In this demonstration, we'll be showing you AliMed's proximity sensor, an exciting new fall management technology offered exclusively from AliMed. You'll see how this unique product can benefit your facility by enabling better patient care. We'll also tell you about the specialized features this product offers and how to use them. If you're looking for a patient or resident monitoring solution that will deliver quicker warnings and that can be used with any size patient, big or small, AliMed has just the thing for you.
Hello, I'm Heidi Young, a member of AliMed's customer outreach team. As a member of that team, I visit many healthcare facilities and we really listen to what you have to say. AliMed wants to make your job easier, safer, and more effective. I am pleased to say that we have accomplished exactly that with the new proximity sensor, an exciting step forward in fall management. This new sensor technology allows you to respond sooner to patients at risk of rising or falling from the bed or chair. It works by sensing the patient's proximity rather than weight. This solves many of the issues faced with traditional fall alarm sensor pads. AliMed's easy-to-use proximity sensor is the only sensor without weight restrictions, sensing even your lightest patients. And because it senses the nearness of the body, not the weight, it provides earlier warnings than traditional sensors. The sensor is paper thin, works on all air support surfaces, and get this, it will even fit your existing alarm, which means you don't need to replace your current system in order to be using the latest, most effective technology. Join me now as we show you this innovative product. In just a few minutes, you'll see how the proximity sensor works, how to use it, and how it can revolutionize the quality of your patient care. One of the most common concerns voiced to AliMed from healthcare providers is that alarm systems simply do not alert caregivers fast enough. Typical patient alarms will sound after the patient has already risen or has left the bed or chair. That's because weight-dependent sensors frequently require placements under the buttocks. The alarm then sounds when the patient rises, giving the caregiver very little time to react. Weight restrictions are a big concern with typical sensor pads. But unlike pressure-reliant pads, the proximity sensor does not require pressure to trigger the alarm. With this all-new technology, worrying about the minimum or maximum weight restrictions is a thing of the past. The sensor works simply by detecting how close your body is to the sensor. Actually, it works much like an antenna, detecting the minute electrical field that surrounds the body. Watch as I activate the alarm. See how no contact is actually needed for proximity sensing. The sensor's versatile design allows for placement in optimal locations, such as behind the patient's shoulders while on the bed and on the back of the patient's seating. This allows earlier alerts and reduces false alarms. Not to mention, shoulder placement greatly reduces contamination risk from bodily fluids. The sensor itself is a thin sheet of either Tyvek or Mylar, the thinnest sensor material on the market. Both materials are durable and deliver outstanding performance unlike any other pad. Neither can be easily ripped or damaged from folding, rolling, or crinkling. The Tyvek material is also moisture vapor permeable, allowing the skin to breathe and remain dry. And what really makes these sensors so versatile is that they can be cut to any length. This means one size sensor fits all. Now I'd like to show you how to use the proximity sensor. Let's begin by quickly identifying the various components used in this simple setup. For setup, you will need a connector, and depending on your alarm brand, you will need the appropriate cable to connect the sensor to your alarm. For the purpose of this demonstration, we'll use AliMed's TR2 alarm. As mentioned before, the proximity sensor can be used with any alarm, even your existing alarm. Okay, now that you're a little more familiar with the components, let's begin setting it up. First, attach the cable to the connector. Then attach the connector to the sensor by snapping the two units together. Now connect the cable to your alarm using the alarm sensor jack. Simple. For bed use, place the sensor in the bed beneath the shoulders at the normal resting position of the patient or resident. So thin, yet resistant to fluids, the sensor goes unnoticed under a fitted sheet. With the sensor placed under the patient's shoulders, the alarm will sound the moment they try to get up, while also effectively limiting false alarms. For chair use, cut the sensor to the desired length. Place it behind the back or shoulders, not beneath the buttocks. Remember, this will ensure the earliest possible warning. The device will sense normal movement in the chair as long as the patient's body is in close proximity to the sensor. Again, this reduces the number of false alarms. As a caregiver, you know the struggles faced with using fall management systems with lightweight patients, especially when using air mattresses. But because this sensor uses proximity, not pressure, it works even on top of air mattresses, unlike traditional sensors. No pressure-reliant pad can do this. Just as with other alarm systems, you can connect a nurse call cable using a nurse call connector. Importantly, the proximity sensor can be purchased complete with an AliMed alarm, ready to use, or with the appropriate cable to upgrade any other alarm brand. And as with any patient monitoring device, always make sure to test this alarm system before use to ensure proper function. You've just seen how the proximity sensor is the obvious choice for the earlier warning system your facility needs. We know that your patient or resident safety and well-being are your main concerns as a caregiver. AliMed is making sure that you have the very best in patient care solutions, and I know that you will just love the ease of use and reliability the proximity sensor offers. And remember, earlier alerts mean fewer falls. I'm Heidi Young for AliMed. Thank you for viewing.
You've just viewed the instructional video for the proximity sensor, available exclusively from AliMed. Remember, this device is not intended for use as a substitute for visual patient monitoring. The alarm alerts caregivers to attend patients or residents who have risen or are about to rise. The alarm itself will not prevent falls or patient wandering. For more information and to order proximity sensors, go to alimed.com, keyword proximity. AliMed.com is home to over 70,000 products, including our entire line of patient and staff safety products.